Now, live with Greg Olson, Director of the New York State Office for the Aging.
Good afternoon, everybody. Thanks for joining me today. My name is Greg Olson, and I'm the Director of the New York State Office for Aging. We have an incredible show to bring you today. I think some of you may have known that we have about 29 public-private partnerships with technology companies serving 1 million more people. And the one that we're going to talk about today is really, really unique, and we're excited to partner with the folks at BetterAge, and I'll introduce them in a second. But what I did want to do before I brought Jim and Diane on is just to make a quick statement. I know that there's a lot of uncertainty going on at the federal level with a variety of programs, whether that be the Veterans Administration, potential reductions to Medicaid, Medicare, limited access to Social Security, changes within HHS, and we're monitoring those very, very closely, so that we can just bring the facts to you on if there are any changes, what those changes are, and what they will potentially mean. I was very fortunate to join our governor, Governor Hochul, and our junior senator, Senator Kirsten Gillibrand, on Friday to do a press event on the changes that are coming for Social Security that are going to limit access and what that's going to mean to individuals. So these are things that you're going to need to pay attention to as they roll out. This has nothing to do with politics. What I'm going to talk about today are really the facts that we have at this time. We have done an impact analysis, and you can see that in our press room. I believe we're going to have a lower third coming up in that. But one of the things that I want to talk about is the restructuring in HHS, Health and Human Services. That was announced last week. Health and Human Services oversees a variety of organizations like the CDC, the NIH, and many, many others that are talking about being consolidated. Why do I raise HHS? Because the organization that we report to, which is the Administration for Community Living, is part of HHS, and they have proposed to dissolve ACL. And what ACL does, it was created in 2012 to bring together the Administration on Aging, which is our oversight agency, and 2 disability organizations to better connect aging and disability services. The proposal is to move some of those functions into other parts of the new reorganized Health and Human Services. And the reason I point this out is because most people know the types of services that our office administers and our area agencies on aging and their 1,242 partners across the state provide. We do shows on this all the time, but they probably don't know what the source of those funds are, and that is ACL. And so we did an analysis, you can see it right there, on a state level, county by county, and congressional district, on if we were to lose federal funding for these programs, what the impact would be. So as I mentioned, I guarantee you know the types of services. We will have an impact on home delivered meals, for example, congregate meals in senior centers and other congregate sites, nutrition counseling and education, transportation, case management with our most at-risk clients, social model adult day services, legal assistance, information and assistance, benefits application assistance, outreach, programming in senior centers, health promotion, personal emergency response systems, services that people provide to a loved one, caregivers, those that are providing care to somebody and not getting paid for it, a spouse, an adult child, family friend or neighbor, and health insurance counseling, and there's many others. We always talk about here that older adults just don't touch the New York State Office for Aging, and that's the same thing at the federal level. We touch transportation, housing, mental health, Department of Health, alcohol and substance abuse, veterans, and on and on and on. So we're going to continue to monitor that so that we understand, what potentially is at risk. At this point, there has not been any action besides dissolving the Administration for Community Living. But these are the types of things that older adults and their families rely on every day for their economic security, to be able to eat, to remain as independent for as long as possible in their homes and communities. I will wrap this up by saying, in our network, at the State Office for Aging and our local partners, there is no waste, fraud, or abuse. There's none. We can account for every service, for every dollar, who it goes to, and where it goes. And as mentioned, we are serving well over 2 million older adults and their families in New York State. So I urge you to check out the analysis we did that is in our press room so that you can see. And the only part of being in a democracy is actually participating in it. What we're trying to do is make sure that there's no harm done to the Administration on Aging and to the Older Americans Act. And you can do that by reaching out to all of your members of Congress. So again, despite what we're seeing and continuing to monitor from Washington, there are not two better guests that I could have right now. My good friend Jim Firman used to be the former CEO of the National Council on Aging. He is now with BetterAge. Known Jim for a number of years, have worked with him on a lot of projects that he's developed. And Jim, it's so great to have you with me today. I'm excited for you to show us the new tool that you and Diane have developed. And of course, Diana Yin, who also works at BetterAge. Haven't known her quite as long, but she is a spark plug and firecracker. She's the CEO and co-founder of BetterAge. And what they're going to do is talk about the value of making the case using data to help the individuals, either individually or in a congregate setting, like a senior center, be informed about what the people who are going there, the older adults themselves, where they're thriving, where they're struggling, so that we can tailor responses based on what actually people say about themselves. And what better way to do that? If I was running a senior center, how do I determine which programs are effective, which ones are relevant, which ones are not, without knowing exactly what the census of the folks that I'm working with are? And that's what these guys are going to do today. So to the two of you, thank you so much for joining me, and welcome.
Thank you. It's great to be here.
So again, NYSOFA has partnered with BetterAge to pilot this new tool we're going to talk about. I think you're going to be extraordinarily impressed. And we're working on a phase 2 here in New York to expand it to more sites. And again, it measures the results of healthy aging and generates really important data in a whole bunch of areas that matter, not just an area here or there, but looking at it holistically and how we can age better and address some of the gaps and needs that we know. 80% of the older adults who start this assessment, which is not difficult to do, reach completion. And then you can tailor a plan based on that. The assessment measures well-being and identifies who's in crisis, who is struggling, who is thriving in such areas as quality of life, finances, physical and mental health, activity limitations, meaning and purpose, isolation and loneliness, belonging, social supports, and much, much more. So again, thank you guys so much, and let's just dive right into this. Jim, tell us about BetterAge and why was it formed, and what exactly does it do?
Thank you. It's great. It's great to be here. Well, it's formed because I, like you, Greg, have dedicated my professional life to improving, helping older adults. And when I was at NCOA after 25 years, I was ready for a next chapter. And what I saw there were 4 things: that even though our field is full of dedicated people, we weren't measuring what really matters. Most of us believe that we're here to help older adults to improve holistic health and well-being, but we weren't measuring it. And if we're not measuring it, it really doesn't matter. So we wanted to make it possible for people to easily measure holistic health and well-being. The second thing, as you alluded at the beginning of the show, policymakers and organizations need better data to demonstrate and prove to policymakers and funders the value of what we do. We know that delivering a meal is more than just alleviating hunger. It affects the quality of life, but we haven't had the tools to measure that. The third thing is that we know that older people, all of us, don't need another fact sheet. We don't need more general guidance on what to do. We need very personalized guidance that's specific to me, my needs, my preferences, etc. And the fourth thing is, as we see the numbers of older people growing, for example, a recent report at NYU says the number of people with Alzheimer's dementia is going to double in the next 20 years. And they say there are 7 or 8 known risk factors that if people would only exercise more, eat more, check their hearing and vision, and be more socially active, engaged, you can make a difference. We need to find ways to reach and be relevant to people earlier on in their aging journey, not just when they're in crisis. So it was these 4 reasons that inspired us to come together and see if we can create a tool for the aging network and for others that can accomplish these 4 goals.
Yeah, and I mean, you're spot on. And I think one of the great historical reasons why I've always partnered with you and now partnering with Diane are, implementing things like the Aging Mastery Program, which we measured here in New York and elsewhere and implemented. During COVID, you created an amazing tool that took all 5 minutes for you to convince me to invest in, that really measured the risk of getting COVID, being hospitalized and dying, but also addressing people's needs based on what they did every single day. And now you've got this new tool. So Diana, what else can BetterAge do to help older adults in New York?
Well, there's a lot that we can do in New York. We are trying to also move into engagement. So right now we have a lot of measurement, and like Jim said, measure what matters. We need the data, as you were saying. But we also want to help older adults directly. And we learned that in our pilot supported by the NIH grant, that older adults really appreciate the weekly check-ins. And these are not overly intense check-ins. We work with and have on staff a wonderful positive psychologist, and he sends a note once a week. And in 4 weeks, people have really shown that they've taken our recommendations, at least one of them, and really taken action. I think later we'll touch a little bit upon some of the engagement techniques that we have, but that's just one exciting initiative.
That is, and engagement's key, which I love that. So we work with a couple of partners where, by sending out those weekly reminders or engagement, regardless of what it is, we saw a 300% increase in engagement. We have another partner where, they offer over 5,000 classes, lifelong learning, et cetera. The top 10 taken in New York State by older adults for the last 4 years are all health and wellness classes. So these are things that older adults are embracing for themselves to improve their health because they want to. And I think that that's really, really important. So Diana, what would you say is next for BetterAge?
So what's next? A couple of things. So the first is, and thank you for asking, and thanks for having us on the show to talk about these things. So what's next for BetterAge? We have I mentioned the NIH sponsored grant, and that grant covers a 3-year study, and we're 1 year into it. So the next 2 years, we'll actually be diving deep into what Jim had talked about in terms of personalized actions and recommendations. And we'll also, over the next 2 years, be doing a randomized control trial, which will allow us to get the evidence that some of these personalization techniques work. So that's one. The second is we'll be starting to reach out to innovative organizations, healthcare organizations, health providers who really care and are aligned with us, that what we really want to embrace is the idea that what's good for older adults is actually good for the healthcare providers that serve them. So when we find folks who are aligned with that same idea, that when we help older adults, we also help the healthcare system, right? And all of the ways that they need to support an older adult that they cannot because they really focus on the clinical side, right? So when we blend what we call the social care network and all the things, Greg, you're in charge of in New York State here, and the clinical side, then we've got truly a holistic view. And we say internally, an older adult is not a medical record, right? An older adult is so much more. But in the clinical system, sometimes we really just do default to the medical record, and all these other things that are so core to a person's health and well-being are not part of the diagnosis or the prescriptions. So we're really looking for alliances and partnerships who believe in that with us.
Yeah, and I love your answer because we talk about all the time, right? The growing older is not the problem. It's how this country has organized its caring economy to really focus on the back end, treating the sick rather than spending, resources in the community, bringing together the three parts of the stool: technology, social supports, and clinical supports together in a comprehensive and coordinated way. We were talking before the show. And you guys know as well as I do, I love numbers just like you guys do. We have almost 900,000 volunteers providing 470 million hours of service at an economic value of $13.2 billion every year.
Wow.
Many of these are obviously working in our network, providing transportation, delivering home delivered meals, food service in a congregate site, health insurance counseling, long-term care ombudsman, but also all the other not-for-profits that are not aging oriented. You guys recently added, as part of this checkup, some data on volunteers. Talk a little bit about that.
Yeah. Hey, Greg, can I hold on? I first want to tell you about the New York pilot, the project that, if you don't mind. But
not at all. That's
yeah. About, Greg is has a national reputation as being the most innovative state director on aging, and it's a well-deserved reputation. And I think it comes from, she was telling us about that, he has a background in direct service as well as policy, understanding what really matters for people. So when we were first developing a year and a half, 2 years ago, the idea for BetterAge, I went to Greg and said, Greg, here's what we want to do. What do you think? Will you let us give it a try? Can we go to the slide of the partner? So Greg, being Greg, he said, yeah, we like innovation. So we reached out to 5 innovative organizations across the state and invited them to participate in this pilot project. The West Seneca Senior Center in Buffalo area, the town of Amherst Senior Center, also in the same part of the state, Lifespan in the center of the state, where I think Greg worked as a young whippersnapper, place in rural areas near North Albany, and self-help community services in New York City. And we went to these groups and we said, let's give this tool a try. Our goal was to reach 1,000 people and have them use the checkup, use the service, get the screening, get the data, and provide help to them. We reached 1,465 people, and we also learned a lot. We learned through our great work of our partners that in order to reach hard-to-reach people, particularly people who may not be digitally literate or may not have internet access, we needed to complement our digital solution, which is available on all kinds of devices, with a paper survey. So we tested that, and we proved that it worked, and that led us to learning some things. So let me tell you about some of the things that we learned from the New York pilot. Next slide, please. So first of all, you get an overall picture, whether it's of your organization or the total population. This is, I think, representing the close to 1,500 people in New York. What percentage of people are thriving? And basically, green is good, red is terrible, brown and yellow are great. Red is really in crisis, brown is struggling, yellow is surviving, green is pretty good. So what you see is that for each dimension of well-being, there's somewhere between 2 and 10% of people who are really in crisis. They're struggling. They really need things. And then depending on the issue, another 10 to 20% who are not doing well at all. This gives you, for the first time, at an individual level, a picture of what's really going on in people's lives. And this is just at a high level. If you segment it by different populations, you get different differences. The next slide, please, is then in addition to well-being, so that's the first set of powerful questions. How well are you doing using certain validated self-reported measures? The second thing is what's preventing you from aging well? And this slide, we go through 17 different barriers. And this is important for two reasons. One, it gives you an organization a picture, both at an individual level or a center level or a client level, of how many people are struggling in different areas, which is data they haven't had before. But the other important part of this is the information on the right, the distribution of barriers. Some people, as you say, almost 48% have 0 or 1 barriers, and yet you have another almost 40% that have 3 to 10 barriers. And this is really important because we cannot help a person to age as well as possible if we don't know specifically what it is that's holding them back. This is, again, information that empowers both policymakers and empowers organizations. Next slide, please. Then the third thing is, you want to know how well you're doing, what's holding you back, what do you want to work on? You know, you got to go and people, what are people's priorities? And when people look at this, and this was largely a senior center population, we're not expanding it to other groups, people would say, yeah, I knew they wanted physical activity, I knew they wanted nutrition, but many of them said, gee, we're not offering any programming on sleep, and that's 41% of that. And by the way, some even newer data we have showing that brain health is also something that's really important. So organizations need to know what people want to work on in order to help them do that. And then I could keep going for a few more. Next slide. You'll keep forward to the next slide. This one was really interesting. If you go back to, you don't have to go back, but what we learned on the earliest slide was that 20% of people were saying that they were reluctant to ask for help when they need it. 1 out of 5 were saying this is a barrier. So this is an example of the power of combining different data. So then we had our data scientists. We've got a great team of great data scientists. Say, what's the difference between people who say asking for help is a problem for me versus saying it's not a problem? What you see from that slide, which is really, go back to that slide, I want to make sure people are seeing it, is that people who are reluctant to ask for help, people on the left, are doing 2 to 3 times worse on every dimension of well-being. And this is really important both at a policy level and an individual level. We're seeing a very strong correlation between people. We can't say it's caused by it, but the correlation is there. This to me screams out for public education about asking for help is not a sign of weakness. It's not a sign of dependency. In fact, it's a key to aging well. It also, and I can relate to this personally because I was one of these people who would never ask for help, right? And I've been, for the first time, a principal investigator on an NIH grant, 73, maybe the oldest first-time one. They can't quite tell me, I cannot fill out these online forms. I spent 2.5 hours trying to fill out these forms. I'll leave out the adjective. And finally, I gave up. After 2.5 hours being stuck on one form, I called the helpline and said, I'm 73 years old. I've never done this before. Please help. And guess what? They helped me. And now I feel like I'm Aladdin with the magic lamp. It's the first thing I'm out of my mouth whenever I go anywhere. I'm 73 years old. I've never done this before. Please help. It really can be that simple. The other thing that's important about this, if you know that you have a client who, is worried about falls or whatever the issue is, but is reluctant to ask for help, you want to reach out to them and not wait for them to ask. And this, by the way, brings me to your question, because that was about asking for help. We also learned something about volunteers. We've just added this question most recently, but what we've learned, we asked people, are you volunteering, yes or no? And then we had 3 questions. Are you volunteering now? About 45% of older people say, yes, I currently volunteer. That statistic's been steady for many years. We also said about 20-something% would say, no, I don't volunteer and I'm not interested in volunteering. But 1 in 3 people say, I don't volunteer now, but I would consider it if somebody asked. And then what we did, we went and looked and said the same thing we just did for asking for help and said, how do the people who are volunteering compare to the people who aren't but are interested in doing it? And what we're finding is significantly people who actually are volunteering rather than just thinking about it have a significantly higher quality of life. They're less lonely, better mental health, stronger sense of belonging and meaning and purpose, more positive emotions, less negative emotions, and are having more fun. So this now means that if I'm an organization, I'm going to reach out to these people, not only because I want more volunteers, which I'll get, but because I'm actually going to improve the quality of life. These are the kinds of data that, and it's just the tip of the iceberg, things that we're learning that our tool is empowering organizations to understand and to take action.
Yeah, and what you just said about the data you receive from volunteering, or those are, again, all the risk factors for getting dementia and Alzheimer's disease, right? So there's a ripple effect, excuse me, in all of this. And what I really like is, again, when you're able to do the deep dive on the slides you just showed, how many senior centers have financial literacy programs? Hardly any of them, right? Asking for help in this country is culturally a problem for us, right? I often hear, well, you at the state office for aging or the county, you don't do a good job with education and outreach. And I outright deny that and say, no, people don't need to know what they need to know until they need to know it. And it's usually in a crisis. And so these are all efforts in what your platform does to be able to not only get a sense of, in a particular community or setting, what the masses are thinking and be able to tailor those approaches, but again, asking for help and addressing the engagement, all of those things that are going to make life a lot better, health a lot better, emotional health better, financial health better, and so on and so forth for older adults. We're going to show you a quick clip that BetterAge produced that provides a little bit more context in terms of what this really is designed to accomplish. Check this out.
We combined forces with respected organizations and leading experts from many fields to develop a 3-stage program for older adults: awareness, action, and achievement. BetterAge will help you gain awareness about 13 areas of health and well-being. Paired with information from your doctor and other people you rely on, you will then have a comprehensive start to understanding your holistic health. With the trusted guided recommendations from BetterAge, you'll be encouraged to take action among goals you choose, since you are in charge of you and you know yourself best. That first step is all you need to start. Your payoff will not be achieved by a magic pill, but by a magic mind. You've proven you could do it. Each step has led you to another, building your strength and resolve each day. You are the hero in your story, and BetterAge is grateful to help you live your best possible life.
I love it. So we talked a little bit about the pilot, and you've done, this isn't just in New York State. I remember you showing me data from, I believe it was Maryland, and what the impact of the particular center was when they did this, meaning the behavior change in the staff, their communications with their, whether it be city council or others. Can you just talk a little bit about that? Because that's something that always stuck in my head, was because we did this, we changed all of this.
Yeah, so there was the case was in Baltimore County, which was the first organization to adopt. This was even before we had the digital version, just the measuring what matters. And they applied it to about 20,000 people in 14,000 people in 22 senior centers across Baltimore County. And they noticed in about 4 or 5 of them, they had significantly lower physical health scores. They dug down a little deeper and found that those were the centers that didn't have full gyms, full-time health promotion staff, and Saturday hours. They took that information to the county council, and within 30 days, they got an appropriation to because they could identify and address an obvious disparity. That's one of the things we hope to be able to do, shine light on what's really going on, whether it's by center or whether it's certain population. The other thing we've seen, which is very dramatic, if you compare the well-being of homebound people versus people who are more active. Now, we all kind of know they're homebound, they have physical limitation, then they need food, and they might be lonely, but you get a much more dramatic picture of the other aspects of their quality of life. And that is spurring organizations and foundations to say, let's target in on that population.
Yeah, exactly. And when you are, alone, you are isolated. Again, it's all those risk factors again. And for our population, who they're not homebound, but they have a lot of, ADL and IADL daily activity limitations. Our average person's an 83-year-old low-income female, lives alone, 4 to 10 chronic conditions, and multiple ADL and IADL limitations. And it shows that. Like even in your congregate sites, the number of individuals that had mobility limitations, for example, was quite large. So that could be a transportation issue to get folks to the center as they age. So there's just so much that you can really glean out of that. Now, we talked about the pilot. So we started with 5 sites here in New York, and really happy to be able to partner with Nora O'Brien-Surik and the Health Foundation of Western and Central New York and all of their staff. We'll be meeting with them next week to do an expansion into more counties and more sites, whether it be in Western New York or other places. And what I think is really important about the expansion, Jim and Diane, and you can speak to this, is there's a big difference between the town of Amherst Senior Center and in a senior center that's in the urban part of Buffalo. And to be able to, kind of spread out a little bit and look at rural older adults in, Chautauqua County, or could be Niagara, urban, et cetera, and be able to, again, have that much more data to be able to address those needs. So, talk about, I hope you're as excited as I am. I think that you are, but, talk about phase 2 a little bit.
Go ahead.
Yeah. If we're excited about phase 2, I think the additional data that we're going to be able to get from all over the state is going to be important to us to understand the disparities in different communities. The other thing that we're actually trying to understand is whether any of the external data that is available through the census and other sources can also be layered upon the data. So the data that we're collecting, so that we can see whether there are other factors that are going on that are actually in the community and well documented. Whether there's a clean water supply, whether that makes a difference in well-being, so things that we're not directly asking people about can also be things that we understand. We are going to be offered statewide on the website and NYSOFA website, so we're excited about that. And Greg, if you could just permit me one deviation a little bit. There's a really interesting graphic that I wanted to just show people. And it just really, I think, encapsulates why we believe that all of this, of what we're talking about, is intertwined. It's all interrelated, and it's the graphic on chronic conditions. And this is just another thing that we have been talking about for years in our communities, that suffering from multiple chronic conditions has a real impact on your well-being. And if you look at all the things that we measure, it's quite small here, but it goes everywhere from quality of life, as we've mentioned, through sense of belonging, loneliness, etc. All of those measures, when you look across the page here, if you have 3+ chronic conditions, you are thriving less on every single one of those dimensions. Now, you may think some of it is obvious. So physical health, right? And there's clearly a correlation in some chronic conditions with mobility, and physical health. But all of the others are also impacted when you're trying to manage multiple chronic conditions. And these are things like diabetes, right? Things like hypertension. These are high cholesterol. These are things that many in our audience right now probably know that they have, right? And so when they're not managed well, then it impacts all of these other dimensions. So I just wanted to name name that, because chronic conditions are very much in our national conversations, and it is a really important angle for us. Chronic conditions, and I used to work at Unlock, which is the inventor of the PACE program. And we used to say at Unlock, healthcare is only a little bit of what we do. I mean, we do healthcare, But really, we were long-term services and supports and social supports, right? And being able to blend that, that's how you manage chronic conditions, right? It's not always just the medicine that you take, although that's important, and what your doctor's orders are, but it's all these other things like sleep, nutrition, regular physical activity, etc. And this is the work that we're grateful to help older adults with as they continue with the BetterAge program. And that's why we're excited about the engagement piece.
And I'm thrilled that you raised that, because the platform, you're right. I mean, chronic conditions by 2040 will cost the United States $800 billion in spending. They're preventable and they're manageable. So part of this platform, right, if you get people in that 0 to 1 or 0 chronic, you want to keep it that way. And for those that have more, you want to manage them better. And those are all programs and services that can be provided through the local offices for the aging and their partners. They can be done technologically if you have access to the internet. And, I think a lot of people still believe that older adults don't use tech that often. They do. They use it at the same rate as everybody else, or it can be in an in-person setting. And we're seeing that all over the state. So I really do appreciate you raising that. I think it's really important. If an older adult, let's say you're out in Saratoga and you're talking about the platform, and somebody pulls you aside afterwards, because they always do, and says, what advice would you have for an older adult who wants to age as well as possible? What would you say?
So I'll tell you, I'll begin with a personal story. About 15 years, you can put up that graphic maybe. About 15 years ago, I've been in the field of aging for a long time. I had my first brush with mortality. There was about 3 days when I contemplated that, I might not be around the next week. And fortunately, everything worked out okay. I'm still around. And but what that made me realize was that a key to aging well is being grateful for the gift of time. Think about the people your age who are no longer with us. No matter what what challenges we're facing as an older person, we're still here. And with that comes 2 important points. One, be grateful for it and be appreciative of the fact that public health and services and programs have made, and luck and all those other things have helped. But then also spend your gift wisely. Spend each day intentionally doing things. How do you spend 10 minutes? How do you spend an hour to do things to improve the quality of life? And then second to that, realize that just it's small steps. It's little things that you can do that can make a big difference. So if you have intention, if you take advantage of what the knowledge which we have and the program, it can make a huge difference in your quality of life. So those are, I think, and then the third piece is advice that I got from my mentor, a fellow named Arthur Fleming, who is a great giant in the field. And I asked him, Arthur, what's the key to vital aging? And he told me in 2 words. He said, keep going. And that's the other piece of advice for people. Don't stop. Keep going. Live each day passionately. And those 3 things have meant a lot for me.
Yeah, and you read, at least I do. I read articles all the time on, older adults saying, here's the things I would have done differently, right? And, that sense of purpose, and going back, Diana, to what you said, when you're talking about chronic conditions. So it's purpose and a positive attitude can make a huge change. But how can you have a positive attitude when you're dealing with all of these multiple chronic conditions, which then can lead to multiple medications and adverse drug it could go on and on and on. So, in New York, we have 4.1 million caregivers that are caring for somebody. The majority of them are older adults, but not all of them. And their contribution saves $39 billion. We've always known that family, friends, and neighbors are the number 1 providers of long-term care. They're the number 1 providers of social services, and they are integral in healthcare and healthcare follow-up. So if a caregiver in Saratoga came up to you and asked you the same question, what advice would you give them?
That's a great one. I don't know if many people know, but my mother was one of those caregivers, not quite in New York, but in New Jersey, not on the border state, because my father had multiple chronic conditions, and one of them was Lewy body dementia. And I think that the most important thing for her was finally asking for help at perhaps our urging with the county. And the county was able to provide some help in respite care and in home care. So, and it wasn't many hours, but so one, the asking for help. This is such a hard job. And people sometimes don't realize it because they're the unsung heroes and they don't have time to talk about what they're doing at home. And oftentimes, for many cultures, it's not. It can be embarrassing, right? All the work that one has to struggle with at home, and oftentimes it doesn't come through, right? Because there is a they're more homebound than otherwise, and so the first thing was asking for help from resources, and there are resources, and I know the state of New York has a number of good resources that can help. The second thing is respite care is absolutely crucial in this job. Absolutely crucial. You need a break, right? The third is to talk to people, to form those connections, whether they're online or just a hello and a walk in the neighborhood. So this idea of forming connections and self-care is really important. Then the fourth thing I'd say, Greg, because caregivers are really near and dear to my heart. The fourth thing I would say is that this is a big change in one's life, a huge change, right? And even we even tell the older adults that we work with that aging is about managing change. Becoming a caregiver is an even bigger change, right? So it is about being kind to yourself, right? And it is about recognizing that sometimes managing change does not come easily and that you kind of have to give yourself a little bit of grace, right? Give yourself a little bit of a break. Not everything has to be done just right. And I'll tell you a little story. My mother had so many medications to manage because of all these conditions that she would wrap, and the doctors told her all these different instructions. She would wrap the pills in different, I would remember her ripping napkins into squares, and each napkin square would have a packet of medication. And then she would line up the packets on the counter. She'd fold them up like origami, pack them, like line them up on the counter. And for that week, this was the AM pack, the PM pack, the overnight pack, and then starting at AM pack, right? So that she had, it took a really long time to do that.
Yeah,
Right.
not very scientific either, right?
Right, but you're home figuring it out, usually
Yep.
on your own, right?
Yep.
And so
Exactly.
give yourself a little bit of leeway, right? A little bit of leeway and figure out like that there are people who can help, right? So
Greg, could I just underscore one couple things?
Of
Diana,
course.
this is great. First of all, you are funding several innovative programs that can do wonderful things for people with dementia, training, education, etc. And so there really are terrific resources that people should take advantage of. And then the only other thing that I would mention is Diane mentioned, we're just completing up a first pilot study, which had two populations, general population of older adults and care partners with people living with dementia. And one of the things that we learned through that is particularly relevant. Caregivers don't have a lot of time, so they can't go take an exercise class for an hour. They can't do anything so look, if you're a caregiver, look for things you can do in 5 minutes or 10 minutes, little bite-sized things, and we help suggest them, whether it's meditation or stretching or a little gratitude practice. But you've got to grab those moments when you can. And as Diana says, it's an overwhelming experience. And you've got to ask for help, take advantage of resources, and connect to other people. But it's such a critical thing to do for our society to support those caregivers.
Absolutely. I mean, there's so much swimming in my head because you guys raised some really important issues. We have, 45% of the caregivers for our existing clients are working. Most are working full time. So can imagine going to work full time and having to deal with, phone calls, leaving early, coming late, cutting back hours, not taking promotions because you can't leave. We have all of that data because we surveyed state agencies and the private sector, know how many hours, what the conditions are. So you're absolutely right. Folks can go to our website, aging.ny.gov. There's a whole section on caregiver supports, and many of them are free. In addition to that, you talked about managing change. I really like that. Thinking back along the slides that you showed, where you could do this deep dive on where people are struggling and where they're thriving. And as you both know, particularly you, Jim, especially working with Art Fleming, and this is the 60th anniversary of the Older Americans Act this year, and there are direct caregiver supports and there are indirect. So the direct ones were what Diana was talking about: support groups, respite, training. Then the indirect ones were the ones that I talked about at the opening, that take those tasks off of people: transportation, home delivered meals, personal care level 1 and 2, etc., which is why maintaining that infrastructure is so important. But this network was built on legacy contracts. And here's what I mean by that. If you established a program like the nutrition program in 1975, there's a high probability that the same sites exist in the same locations, despite the fact that the communities change. And the same types of services are provided within those facilities, from the 80s, 90s. This is an opportunity to really tailor-made the evolution. There should be a constant evolution of what programs and services you're providing based on the data. And you guys have both talked about the data. We're all data geeks. Data does talk. When you see it, people listen, because there's a general ageist view and stereotype about what older adults are. And you just showed through 6 or 7 slides, oh no, that is not the case at all. It is all over the map. And we have got a group of people coming into my center, for example, that are constant. They're more or less the same people, and so you can tailor those types of responses. Now here's the magic wand question. All right, if you had a magic wand that you could wave to improve the health and well-being of millions of older New Yorkers, millions, tens of millions of older adults across the country, what would you want to see happen?
Should I go first?
You go first, Jim.
My vision is that the aging network will rise to the moment and to realize that we can transform what it means to grow old in America by embracing it as a science and an art and a general practice, rooted in measurement, rooted in knowledge, rooted in understanding what's really going on, and then using that to develop new interventions, make policy case, help the people in Washington and other legislatures understand the value and importance of what we do. But that is a collective effort. It's not 5 senior centers or 50 senior centers. It's all of us measuring the same way, measuring what matters, and sharing data, innovating together. And I believe we have the potential to transform life for millions of people.
Yeah. Can
Diana?
Yeah, thanks, Greg. I'd love for us to show our last slide, because I think that what Jim said is so powerful, and it translates into people, right? We do this for policy, and we do this for people, because people are affected by policy. And look at some of the things that people are telling us after just 4 weeks of being with our program. That someone's doctor thought she looked 10 years younger than she actually is. Again, just after 4 weeks. I love this one. I feel good and my mental state is at an all-time high. And then this wonder's wonderful. All the small actions that you can do every day for yourself. I have created lists of healthy nutrition videos. I've joined an online shopping venue. This is someone who's obviously working on nutrition. and she's maintained her A1C levels. So it all connects, right? And so the nutrition programs, congregate meals, we have to keep all of those things working for our communities. That's all part of it's the ecosystem, right? And so, Greg, I hate to say it because it sounds so self-promoting, but if I were to wave a magic wand, I'd have everyone spend 4 weeks with us. Go through our assessment, go through our recommendations and our personalized guidance. I would have us spend, the 4 weeks with them, light touches, personalized engagement, and then see where they are in 4 weeks. And they're going to feel great, right? I'm hoping that everyone will feel great. And that gives us the confidence to keep going with other things, right?
Yeah, I am hoping the same thing, and I don't think that's self-promoting at all. Here's what I've learned since we started our first tech partnership in 2018. The public has no idea what tools are out there, what's effective, what's not effective, which is why we measure these things, and what can really have a positive impact on the people that they're serving, which is why we're in the work that we do anyway. So anybody that's interested in some of the projects that we've worked on, and BetterAge is in this guide, go to aging.ny.gov and look at our innovations report. What we talked about today was what is BelAge, right? We talked about why BelAge, but I'm going to pick up on something that Jim said that we build into everything, or it was the how. Now I'm going to talk about the why. We've been taught to believe in the United States of America that older adults are a drain on resources, they're expensive, they take more than they give, and they don't contribute. So I'm going to tell you that older adults in New York State pay 40% of state and local taxes, $72 billion. Their spending supports 6 million jobs. Their GDP, which is the goods and services they produce, $736 billion, 63%. I gave you the volunteer rate that are holding up not-for-profits all over the state of New York. And I could go on and on and on. So we want to keep those contributions in our community, try to impact positively the downward spiral that some people go through as they get older by providing tools like this. If we do that, we can improve quality of life. We focus a lot of attention on quantity of life, not very much on quality of life. And this is one tool that is going to help us get there. So, Jim, Diana, can't thank you enough for being with us today. This is great. I'm really looking forward to our future expansion in New York. For others, again, feel free to share this with anybody. Please like our YouTube page. We are going to be talking about, again, volunteers in general, but two particular programs that we administer here, our health insurance counseling and assistance program, and the long-term care ombudsman program, which is goes into residential facilities as the eyes and ears of those facilities to assure quality of care. As always, I want to thank my communications team, Alex, Darren, and Roger, for making this production as amazing as possible. Thank again, BelAge, and we'll see you in a couple of weeks to talk about volunteering. And as Jim had said from the data, sometimes you just need to ask, and you may be able to increase your volunteer rate by 33%. So thanks for joining us. Take care.
Live with Greg is a production of the New York State Office for the Aging Communications Bureau. Please join us next time.